Hey everyone, my name is Dr. Lake, physical therapist and co-founder at Theophilus Health. Today I wanted to make a video describing the differences between conventional medicine and functional medicine. Now most of us have heard of conventional medicine. Most of us know that when you get in a car accident, you don't go see a functional medicine provider, you go see somebody in the ER or the ICU because they're going to save your life. Same with you if you go get a big cut or you have an emergency. You're not going to go see a functional medicine doctor, you're going to go see somebody that is trained specifically at focusing on saving your life or preventing an infection or whatever the case would be. Now, with conventional medicine, typically the focus is more on the disease that you have. So let's just say diabetes. You go to your conventional medicine doctor for a complaint of high blood sugar, or maybe you have feelings of low energy, or maybe you're having issues with neuropathy, and you go to them and they're going to be most likely prescribing you a prescription drug. And that's not a bad thing. However, if the focus is always on symptom suppression, which is often the case with conventional medicine, and again, this is not to bash conventional medicine by any means, the focus of this video is to just describe the differences. But oftentimes in a conventional medicine practice, the doctor is often given about 15 to 20 minutes to see each client or provider, or actually patient rather, and trying to go through their chart, look at all the details of their past medical history, and try to develop a plan that is sufficient that is going to keep that person safe from getting worse, or at least from not having worsening symptoms. So that method is good. However, it's more designed at keeping people from dying and less about keeping people or focused on getting people to thrive. Now let me transition over to functional medicine. Functional medicine is more designed at getting to the root cause. And a lot of people may say, okay, that makes sense, getting the root cause, but let me kind of paint a picture for you. Let's just say that you're walking on a trail and you look over at a big stream, and you see the stream and you see this boat or canoe going down the water, nobody's in it, and you see some oars following behind. And you're like, that's kind of weird that you're seeing that, that's unusual. Well, I guess we'll just pull that canoe out of the water and get the oars and we'll clean it up and no big deal. Well, little do you know, if you look upstream, you'll start to see a big waterfall, and further upstream from that, you'll see two people that have jumped out of that canoe and are trying to swim to shore. Now, I know that's not the best example, but it's the best example I could think of on the spot. That's kind of how your body operates. We're always so focused on the canoes and the oars that are broken in the water, and we're not looking upstream to figure out what exactly or where those two items actually came from. Now, functional medicine is more focused on that perspective. So let me just give you an example. Let's say that you are 55 years old, female, maybe postmenopausal. You're dealing with all these new symptoms that you've never experienced before, and you're starting to experience more weight gain. Maybe your energy's gotten lower, maybe your strength's getting a little bit lower. Maybe you recently had a DEXA scan where they're looking at your bone density and that's starting to get worse. And you're just like, man, what is going on? And most people would say, well, I guess I'm just getting old. Now, if you go see a functional medicine provider, they're gonna do a lot of good work to investigate specifically where you are having issues that are creating the symptoms that I just described. So oftentimes you'll spend about 60 minutes to 75 minutes with a functional medicine provider. They'll go over an intake form. They'll look exactly at your past medical history and exactly where maybe some things went wrong along the way. And they'll start asking some questions to kind of start connecting dots, because functional medicine is focused on the person in front of the provider, and the focus is getting at the root cause, like I mentioned earlier. And we, as functional medicine providers, we focus on connecting dots and looking at the body as a system, as opposed to a collection of different body parts or organs. And when we start looking at the body in that way, and as a whole person that way, and you start looking at the emotional side, the spiritual side, the lack of sleep, the lack of increased stress, the poor food choices, and all these things kind of spiral, and you can start to really create a big onion that is multi-layered and pretty complex. And oftentimes 15-20 minutes is not sufficient enough to really get at the root cause of what's causing somebody's symptoms in the first place. So functional medicine is really designed at getting people to thrive as opposed to just survive. So I hope this is informative for you. I hope that you can appreciate the differences between conventional medicine and functional medicine. And I hope that this video will allow you to investigate the benefits of functional medicine and seeking out maybe a provider that can help you go a little bit deeper in discovering just what might be causing your symptom that you're experiencing. So I hope this is informative. You have a great day. God bless you.